Hi, this is Dr. Neuhaus. I want to talk to you today about a neuroma. Neuroma is a common problem that we see in the office. People will come into the office with complaints of numbness in their toes, sharp stabbing pains in the ball of their foot. Some people will say that it feels like they're walking on a rock or have a pebble in their shoe. Some people will describe this pain as a sock that's balled up between their toes. When they take their shoe off and look, there's nothing there. There's no rock in their shoe. There's no sock abnormality. A neuroma is actually a nerve problem. It's a irregularity with the nerve, typically swelling of the nerve or swelling of the tissue around the nerve, putting abnormal pressure on it. Typically it's worse when you're up on the balls of your feet. If you're on your feet, period, just on hard surfaces, you're going to feel this problem. It can be a numbness, tingling, stabbing. It can be a very bothersome problem. It's typically very easy to treat. Well, I shouldn't say very easy. Nothing is ever easy to treat, but it's pretty straightforward. Fairly easy to identify a neuroma. If you pinch in between your toes, that's the classic test that we use in the office. Pinching in between your toes, and if you can feel that exquisite pain there, you probably have a neuroma. You want to make sure that you don't have pain on the joint. When you move your toes up and down at the ball of the foot in the joint, you can have what's called a capsulitis, which is swelling of the joint, which can be misinterpreted or misdiagnosed as a neuroma. A neuroma typically is treated conservatively with changing your shoes, anti-inflammatory medication. Sometimes we'll use inserts in the shoes, padding to take pressure off of certain areas of the foot. The most common area for a neuroma is between the third and fourth toes. Classically, that's called a Morton's neuroma. You can also get them between the second and third toes, and it's less common to get them between the fourth and fifth or the first and second, but they can occur in that area. Typically, you do not see this in both feet. It's just one foot at a time, though we certainly do see it on both feet, but it's just not common. As far as treatment options, in addition to the other things that I described, I'll frequently do a cortisone injection to calm down the swelling around the area. That's something that can be very helpful. Obviously, you need to come into the office to get an injection. That's not something you can try at home. But some of the other things you can. So I'd recommend you try that. Try changing your shoes, changing your activities, taking some ibuprofen, anti-inflammatory type medicine like that if you're able to. And try some of the pads that are over the counter. We have certainly some other pads that we recommend in the office. But a Morton's neuroma is something that we do see, and one of those things that if you know what you're looking for, it's very easy to identify. Sometimes it can be stubborn, and in certain circumstances they will need surgery to remove the nerve or do some other types of injections. I'll do an alcohol injection to deaden the nerve. There's also radiofrequency ablation where you kill the nerve using heat. There are some different treatment options, but I hope that helps answer your questions about neuromas and gives you some useful information. Thanks for using the website.